The world has been grappling with the unprecedented challenges posed by the COVID-19 pandemic, and as global leaders convene to address the aftermath and prepare for the future, WHO Director General Tedros Ghebreyesus has called for a world pandemic treaty. This treaty aims to create a comprehensive strategy for dealing with potential future pandemics, with a specific focus on addressing the hypothetical Disease X. In this video, we will delve into the details of Disease X, the proposed pandemic treaty, and the implications for global health.
It's about Disease X, a mysterious term that has been making headlines.
So, grab your favorite snack, hit that subscribe button, and let's dive into the intriguing world of Disease X. Disease X is not a specific virus but rather a placeholder for a potential novel infectious agent that could pose a serious threat to humanity in the future. Introduced by the World Health Organization, WHO, in 2018, Disease X represents the acknowledgement that a serious international epidemic could arise from a pathogen currently unknown to cause human disease. This thought experiment serves as a catalyst for discussions on pandemic preparedness and research prioritization. Disease X is not some villain from a sci-fi movie, it's a term coined by the World Health Organization, WHO, back in February 2018. Imagine it as a placeholder, a name given to a hypothetical, unknown pathogen that could potentially cause a major epidemic. The idea is to be prepared for anything, like having a superhero suit ready even before the superhero exists. You might wonder, why not just focus on known diseases like Ebola or Zika? Well, in 2015, the WHO was asked to create and ran Blueprint for Action to prevent epidemics. The goal was to reduce the time it takes to develop vaccines and treatments for emerging infectious diseases. Disease X was added to the list in 2018 to challenge the WHO to stay flexible and prepared for unforeseen threats. These include steps to reduce the risk of spillover from animals, improving disease surveillance, rapid implementation of measures like vaccinations and social distancing, and developing international protocols for fair distribution of drugs and vaccines. It's like having a game plan ready for any unexpected curveball. Director General Ghebreyesus emphasized the importance of a collective and coordinated global response to future pandemics. The proposed pandemic treaty aims to foster an all-of-government and all-of-society approach, strengthening national, regional, and global capacities to effectively respond to infectious disease outbreaks. The treaty envisions enhanced international cooperation in areas such as alert systems, data sharing, research, and the production and distribution of medical countermeasures. Critics, particularly from the GOP, have raised concerns about ceding sovereignty to the WHO through such a treaty. Representative Tim Burchett expressed reservations, stating that the treaty is vague, impacts national sovereignty, and could be exploited to dictate healthcare measures in the event of a global pandemic. Disease X dummy run to test our readiness for a potential pandemic. Governments worldwide started investing in research centers like the one in the UK, specifically dedicated to studying pathogens with the potential to become Disease X. The ongoing negotiations for the global pandemic treaty involve discussions on various preparedness strategies. These strategies include the establishment of an early warning system, organizing resilient supply chains, and advancing research and development to test drugs. The treaty also emphasizes the need to address primary healthcare issues, especially considering the challenges faced by wealthier countries in aspects such as contact tracing during the COVID-19 pandemic. The WHO's assertion that Disease X could be 20 times deadlier than COVID-19 underscores the urgency of proactive measures. The treaty aims to provide a framework for anticipating and managing unknown threats, ensuring that the world is better equipped to respond to future outbreaks. As the world grapples with the aftermath of the COVID-19 pandemic, global leaders are actively working towards a comprehensive pandemic treaty to address the potential threat of Disease X. This treaty, if successfully negotiated, holds the promise of a unified global response to future pandemics, prioritizing cooperation over national interests. While concerns about sovereignty and the specifics of the treaty persist, the need for proactive pandemic preparedness is evident. As we move closer to the May deadline for the treaty signing, the world watches with anticipation, hoping for a collaborative and effective strategy to safeguard against the uncertainties of Disease X and beyond. The call for a world pandemic treaty by WHO Director General Tedros Ghebreyesus serves as a rallying cry for global collaboration in the face of potential future pandemics. This article has provided an in-depth analysis of Disease X, the proposed treaty, and the ongoing discussions surrounding pandemic preparedness. As we navigate the complex terrain of global health, the importance of unity and proactive measures cannot be overstated. The coming months will undoubtedly shape the future of international cooperation in the battle against infectious diseases, emphasizing the need for a shared commitment to global health security. Don't forget to like this video, subscribe for more intriguing content, and hit the notification bell to stay updated. Until next time, stay curious and stay healthy.